Welcome, everybody, to another episode of Need Some Introduction. In today's episode, we'll be breaking down the second episode of the second season of The Pitt. For this conversation, I'm joined once again by my wife, Kim.
Hello, Victor.
Hello, Kim.
It's been a while since we've chatted.
Finally, it's the only time I get to talk to you. Before we get into the conversation, I did want to mention that we will probably begin to cover, or certainly begin to cover, the second season of Drops of God on Apple TV, which premieres next week. We have yet to finish the first season. We have 2 more episodes to go, but we are very close to the end, and we will promise to finish it on time so that we can cover it in conjunction with this conversation about The Pitt. Before we get into the conversation about The Pitt, Kim, how would you pitch Drops of God?
I would pitch it as a comic book show turned into a beautiful story about wine and family.
Very nice, very succinct. So what do you like about it other than the tall French actor? What other things do you like about
I do like him.
I noticed.
He's very, very cute.
Aside from him, what are the things that you admire about the show?
I like the imagery. It takes place in France and Tokyo, and the last episode we watched was in Italy. It's absolutely beautiful, all of the scenery. I also like the moments where the main actress kind of goes into her memory, and there are these beautiful shots of her in her mind as a child, trying to remember different scents, actually, which we can get into at some point.
Yeah, we'll include the breakdown, like a little mini recap of season 1 before we get into season 2. But yeah, I agree. It's really beautiful. You can watch it with your family. We watch it, like 3 generations of our family are able to watch this. And there's no content that's so, at least at this point, nothing that's too sketchy. No, 8-hour erections or anything like that that we need to dodge, child viewing for any reason. So, and as Kim mentioned, this absolutely beautiful production as well. And I love the way, I already pitched this earlier on another episode this week, but I love the way it tells the story I find so many times I watch a show and they kind of have the setup of, this is very true of Netflix shows, and then you kind of wait for 4 or 5 episodes and then it pays off. And this show, maybe because it's based on this manga, this Japanese comic book, so it had like little mini hooks within these separate series that are now all being adapted into this show, that they have these multiple hooks almost per episode. So they really keep you very engaged. And it almost plays like an anthology. But of course, there's this big payoff of this competition between these 2 young people and their hidden legacy, this mystery that's in there. There's a competition, there's a mystery, there's a backstory, there's, all these beautiful locales. It's really impressively designed. Okay, so we'll be talking about that next week. Another thing I wanted to mention that people may want to watch, there's a new movie on Netflix called The Rip. This is Matt Damon and Ben Affleck. They don't often work that together, although they just recently did On Air. But this is a cop thriller / heist movie. Is it a crooked cop heist movie? Someone's trying to steal a load of money. It all takes place over the course of a night. They get a tip that there's some money in this safe house. The safe house turns out to have way more money than anyone expected. And then all of a sudden, it's so much money. Can the team trust each other to not betray each other? Are they being set up? Who on the outside can they trust? Can they tell the police force? Are the drug dealers coming for them? Are other cops coming for them? And it all plays out over the course of this night. And if it's not like Heat, it's not as good as the best versions of these types of stories. But if you like this genre of show, this is very good and has lots of twists. And I thought it was a lot of fun. And Kim, this is shot in New Jersey, pretending to be Miami.
Wow. That just goes to the point that you can do anything in New Jersey.
It's pretty funny. The very last shot, not a spoiler here because it has nothing to do with the story. It's just kind of a little coda on the episode on the movie. Their last shot is, I think, shot in LBI, and it's supposed to be Miami Beach. And I'm like, I don't know if they really pulled that off.
Are there palm trees involved? Because there's certainly no palm trees in New Jersey.
No, there's no palm trees, but they are just watching the sunrise on the beach. Part of the reason they can get away with this, by the way, is that this is all shot at night. So there's no Miami. The pastel colors, all shot in a day. None of that. So the usual signifiers of Miami, not here. I just find it very funny that Netflix has now shot almost everything in the past year here in New Jersey. And we hear in the local headlines, Cameron Diaz was like 3 miles away from our house. Someone was shooting in the middle of Montclair. Natalie Portman was shooting in Verona, right? Like right next to our house. So we're like, wow, everybody's shooting here. But I find it very funny that they are now, they're trying to make New Jersey maybe be New York. They're trying to make New Jersey for that series you watched, The Beast and Me. New Jersey's actually pretending to be Long Island. Now New Jersey's pretending to be Miami.
I thought you were going to tell me that it takes place in Boston when you said Matt Damon, because I automatically think of his Boston accent.
That would be a criticism of this film. That why did they not set it in the Northeast when you have Matt Damon and Ben Affleck pretending to be from Miami? It's like, what? But anyway, other than that, I honestly enjoyed the film and didn't even think about that until I heard like some critique about it on social media.
Sounds like something I should watch. Thanks for the recommendation.
Mildly entertaining, but if you like this type of film, it's a good example of it. Joe Carnahan, by the way, if you are familiar with his work, very much in the genre of the tough guys yelling at each other, pointing guns at each other, and can you trust? I personally have a soft spot for this genre of film, and there's not that many examples of it anymore. It used to be a pretty popular genre, and this is a good version of it. If you love that genre, you'll probably like it even more than I did. Okay, so the Pitt premiered. Some of the ratings have come in. Episode 1 up 300% over the previous season, so much more popular. And the last time we got a ratings update on the show, just to speak to how massively popular the show is, they announced in June, the week after the Emmy Awards were announced, that the show had gotten 18 million viewers per episode on average, which is double what it had done by the time its run was done. And that's all the way back in June. And then, of course, it won the Emmys. Then it played on TNT during the holidays. So who knows how many viewers they have for this. But of course, already with the premiere, the show is way more popular. And I just find it so interesting that I was thinking about how people need this ADHD TV watching. We were literally talking about this last night. And as I was watching the Pitt episode, I thought, well, this is kind of ADHD television because it's like you don't have to pay attention for anything for more than like 5 minutes before you're into another case. The stories progress, but it's like only like 2 minutes at a time. So you can kind of dip in and dip out. And it's kind of how people watch reality TV. I don't recommend you watch it that way, but I think it kind of speaks to the popularity of the show that they're constantly throwing something out at you every 2 or 3 minutes. So if you don't like this storyline, don't worry. In 35 seconds, they'll have another storyline coming back. And I'm sure people all have their favorites. So it's an interesting way to adapt to the ADHD viewership out there in the world. But you can also engage with it. It is meatier than the old type of shows of this kind. So I think you can engage with it more deeply if you pay attention. But if you don't pay attention that much, you can probably keep on top of it. And by the way, Darren, for example, watched the beginning of the series, and then he wanted to see what the big hubbub was about at the end. So he just watched like the previously on and then watched the last 4 or 5 episodes. And he was like, I got what I needed. I'm not going to go back and fill in the blanks. And honestly, you can probably watch the show like that too.
Yeah, I think you definitely can. But if you are, in fact, paying attention, there is character development with each one of these ER providers throughout the show. So there's a little bit more than just your 35-second cases back and forth. And this specific episode did remind me more of ER in how it was done. There wasn't too much drama in hour 2 of this season. So it did remind me of ER.
Yeah, I think this is very much like that. And it doesn't need to do some of that work. I guess it's very similar to season 1 because we really didn't have a lot of character development that early in season 1 either. I guess the difference, though, was in season 1, at least we had to continuously be introducing new characters. And we have introduced a handful of new characters, but the vast majority of the people we're seeing here are just from season 1. So it's just like more of the same, and not in the bad way. It's just the formula. Okay, let's get into the episode breakdown. First of all, the fake cliffhanger last week. And I was once again reading just social media reaction that there had been all this hypothesizing. She's seeing something. She saw signs of some kind of infection. No, she just walks out of the room and Dr. Mohan's like, what was that about? And that's it. And she actually literally asks her later on, what was that about? And she blows it off. So not much of a cliffhanger, I guess, other than an artificial cliffhanger to keep us engaged for next week.
Exactly. That moment at the end where something's wrong with the baby turns out to be Just a way to get you to watch the next episode.
Do you have any? I mean, I guess we have no additional information here about diagnosing the baby. I don't know if you do have a diagnosis, so you can talk to that if you do. Other than that, what did you think about inducing urination from the baby to get a blood sample, a urine sample?
I have not ever really taken care of pediatric patients, but in this episode, they flipped the baby onto her stomach and put her, I guess, hand or fingers in something cold. And then she pees. Oh, that's right. They rubbed her pelvis with something cold. And then she ends up peeing and they're trying to catch her urine sample. So it's a good way to get a clean catch urine without having to catheterize the poor kid.
The other big thing that's happening, of course, here is this whole progressing story that this is Robbie's last day before he goes on a sabbatical, and Dr. Al, his replacement, and how even within, we're just an hour or two, and they are now at loggerheads pretty much regularly in this episode.
Yeah, you can see his minor annoyance every time she speaks. In fact, he's not that much of a fan of her policies so far. And she's certainly not an exciting character like he is.
When I first watched this episode, I watched it with you again after watching it the first time. The initial time I watched it, I thought about this demented woman and how Whitaker, who got peed on or got bodily fluids on him all over last season, that this was like his Groundhog's Day episode where he has to, trying to do the whole compassionate Robbie thing, telling this demented woman that her husband's passed away and that, you know, he has to keep going through this over and over again. It almost became comedic. But then the last time when he takes her into the room and she's trying to talk to her dead husband, it really hits you emotionally again. So it goes from being, you know, comedic to being tragic again. And it did make me think about the fact that is this ER life in general, right? Is it just like Groundhog Day for all these cases that come in and then you kind of roll them out and then there's another broken finger, there's another dislocation, there's some other thing that happens.
Yeah, it is like redoing the same day over and over, just like this poor woman who's been now told 3 times that her husband's dead and it's new information each time. And then she doesn't even realize he is dead. When she sees him, she thinks he's sleeping. But I like your analogy that it is like doing the same thing over and over, which is what all of us do every day, right?
That's true. Not even if you work in ER, just in general. It seems like Groundhog Day for so many of us. Oh, tell me, have you ever had to deal with a demented patient? And have you had similar, obviously not maybe something as catastrophic as this, but how do you deal with a demented patient where you have to walk into the office and they don't remember that why they're there, or God forbid, they're actually in trauma and they wake up the next morning and have to be reoriented all the time?
I've definitely dealt with dementia. Most of my demented patients are not as functional and high level. Actually, sorry, most of my patients who have profound dementia are not high functioning like this woman. She's up and about and apparently lives with her husband and cooks meals and does all these things, but yet she has absolutely zero short-term memory. Most patients who are that profoundly demented are not as functional.
So another case I want to talk to you about was the shoulder relocation, which we watched with my daughter. We did not watch the entire show with my daughter. I was like, that's why I pre-watched it. I'm like, there's a certain part we want to make sure she doesn't watch. That made it too many questions to answer. But the shoulder relocation, she did watch this and she was freaked out by it. Oh, have you to ever relocate? I mean, you worked in ortho, right?
Yeah, I've never seen this. This guy had like an inferior open shoulder dislocation. I've never seen that specific type of dislocation, but we did have to do joint reductions in the ER. Most of them were closed, meaning they're not sticking through the skin. So you sedate them and do what that woman does, where she is like bracing herself on the bed and yanking as hard as you can. That is how they do it. But patients have to be asleep. I think they gave this guy ketamine, which was a good idea.
Later on, they give another patient only ketamine with the broccoli. He's choking on the broccoli. What do you think about that with the difference in opinion there between Robbie and Al?
Yeah, Dr. Al wanted to paralyze him and sedate him to do the scope to pull the broccoli out. They didn't know it was broccoli at the time. And they're kind of arguing about what medications to give him, because if you paralyze someone, then you have to put a breathing tube in and ventilate them until the paralytics wear off. So Robbie said, no, we're just doing ketamine, so we can just do this quick, get the broccoli out, and we don't have to tube him or put him on a vent. So I think his idea is the best.
So we have this ongoing storyline with this patient. I still don't know what's going to happen to this guy, George. I mean, I don't think they would kill him off or give him something tragic in this. They probably want to bring him back in future seasons. This kind of, maybe he recovers. Maybe he like cures himself of alcoholism. Who knows? Or maybe he does eventually die in some future season. Have you ever need to remove this much fluid from a patient?
Yeah, he has liver cirrhosis and ascites, which is like all the fluid that's built up in his belly. And people that have, end stage liver disease do need to have fluid removed. And sometimes it can be liters upon liters, which is what they tapped from his belly. So that's legit.
A next case I want to talk to you about is so Sister Grace with her, gonorrhea of the eye, and Santos's reaction to this. Like she's like, "Come on, don't take this away from me." Is so funny. A, have you seen people have gonorrhea like this in weird parts of their body? And do you buy the nurses? The sisters' explanation.
You can definitely get gonorrhea of the eyeball. I have not personally seen it, but they described the gram stain, and I was like, oh, gonorrhea. Yeah, and they claim she gets gonorrhea in her eye from taking care of dirty linens wherever she is volunteering. So that seems pretty unlikely because you'd have to get kind of body fluid directly into a mucous membrane, but makes a good story.
Yeah, we'll see if it holds up. There might be more to that story. Okay, so here's something that the show has continuously, and maybe you can speak to this a little bit because obviously it was big in season one, but continuously, you assume these are medical providers who have helped write the show along with John Wells. And of course, John Wells wrote ER, so he's been in this, in around this story or this world for such a long time. But there are repeatedly bringing up the business of medicine and how it can complicate doctors' work that they need to accomplish. And of course, we saw that with Gloria, the hospital administrator, last season. We haven't seen her yet. I assume she'll come back at some point. They have mentioned her, so they're not like swapping her out for another actor. But in this episode, one thing that might actually touch on this, and have you ever seen this, is that there's like a bed manager. What does she call herself? Something else. But
she was a case manager, and that guy who had the shoulder dislocation, they decided to transfer him to another hospital because of his insurance. We would not do that. You can only transfer patients if you're transferring them to a higher level of care that you can't provide at your hospital. So we take care of patients regardless of their insurance status, whether they have insurance or not. So that would not be a transfer in the real world, but the business of medicine is always brought up in this show, which I think is a good thing to touch on because everyone is, in fact, always thinking of the bottom line, not the people who are doing the work, but the administrators.
There's also another thing that this culturally does intersect with is we saw it in season one. We haven't seen it yet in season two, but I'm sure it'll pop up as well. It's how politics gets in the way, not only politics of, actual bills that pass, for example, potentially these kind of transfers due to insurance, but also culturally how, messaging from politicians can get in the way. And you think about those people who fought about masks in last season. So that's another thing that kind of is brought up here on the fringes, kind of seeing how medical professionals get caught in the crossfire of these political messages and the impact of it. So we haven't seen more of that yet, but I am curious to see how it is going to have these kind of cultural commentary. But do you think, are there hospitals that have to do these transfers by chance? Do you know if that's the case?
I mean, it's considered an EMTALA violation to transfer someone for the same level of care that you can provide. So that specific scenario wouldn't happen. But we take transfers to my hospital all the time because they don't have the services that they need where they are. So they transfer them for the care that the patient needs.
Of course. And then in the plot here, specifically, this nurse apparently seems to be having some kind of at least hookup, if not more, with Robbie. And she's asking him, can you spend one more night? Well, obviously, I assume that means that so they can spend some more time together before he leaves. And Dana, of course, actually both McKay first is like, what's going on here? She's just like, there's something weird going on here. And she just picks up on things. And then Dana knows overtly, seems to know overtly.
Dana is the charge nurse, and the charge nurse needs to know everything. So, of course, Dana knows what's going on.
That does make perfect sense, right? Like, not only are you probably that type of person to be a charge nurse, but as part of your job, you are probably constantly observing. So you can see, like, when is something getting out of control, when the person hasn't asked you, but you just pick up on the cues. So she's probably looking at this all the time. And she probably sees them walking together and stuff. And she's like, oh.
She is in the know.
Speaking of hookups and not, poor Mel. Last week we were like, oh, it's like cute. Mel might have a date. And the guy turns out to be a criminal.
I know he robbed a convenience store. Is that what it was? And the police come after him.
Yeah, pharmacy or something. And then
Something, yeah. And
he stole a bike.
he runs out of the ER because the police come in, and then she gets knocked over and whacks her head and has a concussion. So poor thing.
Poor Mel. Mel's having a rough day. I like the fact when she's like so afraid of going to court for some reason. Maybe there's some backstory there as well. When the cops show up and they go like, oh, you might have to testify in court just as a witness. And she's like, testify again?
I know she's like becoming very anxious. She's like grabbing her elbows and clearly freaking out that this might be another court case for her. But yes, we don't know what it is that she is involved in, what type of lawsuit. So I'm sure that will come to fruition eventually.
I also like the fact that they kind of give us as an opportunity to see some character development from Langdon, that Langdon was partnered up with her last season. And even though he's kind of this very cocky jerk in that first season, very different in this season, obviously, given his circumstance. Although I assume that he'll probably get back to that point at some point, if not this season, the next. I can't assume that's going to change a lot because this is all one day. So he's not going to have a full character arc in one day. But the interesting thing about his relationship with Mel is that at first he thought like, who's this weirdo? But then over time, he kind of learned to appreciate her, and she has this affinity for him as well. But I really like that when she's being overwhelmed by the talk about going to court. And as we already mentioned last week, her sister is autistic, but she probably is a little bit on a spectrum herself. And in the same way that she had kind of coached him in the way to deal with people who may be on the spectrum, he's like, let's turn off the lights and let's close the door. It could be very noisy in the ER.
And that's the advice Mel had given to another patient who was having some sensory issues on the previous season. She said that exact same thing because she knew that the patient was scared. So he did the same thing with her because he could tell that she was freaking out. So he does have a lot of compassion. And he actually told her the reason for his absence, which everyone knows, but she was like, well, I don't believe rumors. And he told her like, oh, I went to rehab. And she's like, oh, okay. So they have a good relationship.
Yeah, I think this is some character development for him as well, that in a way he may be a better doctor because of him going through this experience.
I like him much more this season because he's not completely cocky.
As I mentioned, that might change. We'll see what he's like next season if we jump another 8 months into the future.
Yeah, if that's his personality, it will definitely come back.
Okay, a couple of things here, a couple of references to AI. I talk about AI in like every different show we cover here on the podcast, but it's brought up overtly here in the show with Dr. Al and all her like, look at all these cool new devices. And I have a question for you because obviously, how is this being adapted into your practice or in your hospital in general? But I love this idea. For me, I think it makes perfect sense. When I first heard about some of these AI tools over a year ago, one of the first things I mentioned to you, even before these tools were available, I'm like, think about what this is going to do for medicine, because Kim is just writing notes all the time and talks about how they have to stay at work late to do billing and these things like that. And Epic, which is this giant system, has started to now incorporate these AI tools just to automatically generate codes based on notes and things like that. But Dr. Al, in this particular case, has an app that is taking the entire history, or listening as they take the patient history, and then automatically updates the chart. And everybody, which mentioned to me that as these student or junior doctors, they probably spend not 40% of the time on notes, but way more than that they see this and they're like, this is incredible.
It is. We don't use software that's that advanced. We dictate our notes into a dictaphone. We have templates we use. Some people still type. I had two new PAs with my group who were with me for a few weeks, and they're typing. And I was literally begging them. I'm like, use the dictaphone. It'll save you so much time. They're like, oh no, we like to type. I'm like, you're going to figure this out soon enough. But the software that she uses to write a note, she just turns the app on and her entire patient interaction gets put into like an H&P that is 99% accurate. There's one mistake with one of the medications, which sounds similar to the medication that she's on. But for the level of accuracy, that would be amazing if we had that. Because yes, we spend the majority of our time documenting what we've done. So you spend 5 minutes with the patient and then you spend 15 minutes at least documenting about it. In terms of your question about like AI being integrated with our current systems. We do have AI software that deals with our radiology program. So we have a new app called AI Doc that specifically looks at data for pulmonary embolisms. And if there are certain criteria with the CAT scan, it gets alerted in the AI Doc and you can log into the app. So at any one time, there's, between 70 and 100 people logged into this app, and you get an alert that this might be something that needs intervention. So this is the first AI app integration that we've been using, and it's certainly partially useful, not completely, but it does provide the data in a very readable way. It gives you all the data points that you need to help potentially make a decision about whether or not this pulmonary embolism needs intervention.
Yeah, I'm very curious to see how AI evolves in that. It's like always like the double-edged sword of using new technology or AI in general. And I was just listening to a Freakonomics podcast about this, and I mentioned some of this to you, but I find it very interesting where they're saying like if you use the AI scan for if you're a radiologist and you use it to identify masses that might be cancerous, that the AI with a human combination is way more accurate. However, when they take the AI away and a year later they have the same radiologist and try to identify this, using their eyes the way they used to without relying on the AI, that they've degraded, their skills have degraded. But to me, I'm like, we have to look at the overall goal. And yes, I'm sure that people who used to be secretaries used to type much, much faster, and nice being an incredibly important skill to have a really fast and accurate typist. And now that's not as important anymore because the autocorrect will fix the typos. And now, for the first time now, just dictating things out loud, that the AI is almost 100% accurate. And then having someone just review your text, you can have one secretary for the whole entire office pool. So all that is to say that different skills will evolve over time. And I think we need to have the greatest good out of it. But of course, there is the risk that if you start to, I work in technology, there's definitely the risk that the positive side of using AI to do lower level development, for example, for my teams, is that we can do a lot more work, and all this stuff that bugs we can never fix and things that never went live now can go live. But then if the business, the decision makers decide to remove everybody and just replace it with AI, now you have no people who can verify. They don't have the skills to verify what the AI is doing.
Yeah, there are scribes in the ER who are mostly young people who are just following around the doctors and nurse practitioners and PAs and writing their notes for them. But in the process, they're obviously learning about medicine, they're learning about documentation, they're learning about all these different disease processes as they're writing these notes. And a lot of these people go on to train in the medical field and become nurses, doctors, and PAs. So I think it's a valuable experience for them. But at the same time, you're paying a salary to someone doing a job that can be done by AI.
Yeah, and I do hope the show does, in its own way, doesn't make it centralize it, but does explore these things in intelligent ways rather than just making it like the new guard and the old guard. I hope that there's a little more nuance to it, but I'm curious to see how they continue to evolve this exploration of the two things.
At the end of this episode of The Pit, Dr. Al is talking to Dr. Robbie outside, and she's like, "So, what do you think of my policies? What do you think of this new AI app?" And blah, blah, blah. And then there's an ambulance that pulls in with a kid in restraints who's freaking out. And he's like, "Do you want to talk about this now or later?" He's like, "I got to do my job, lady. I don't want to talk about all your new policies."
He also is earlier on is like, you have to go with your gut. And, there is a lot to be said with your gut, right? Like there's some times where you're like, I'm not exactly sure why this is off. And it's not just superstition, that sometimes you just say there's something wrong here. And it's just you're intuiting something based on all the experiences you have, and you can't verbalize it, but there's some intuition there, as opposed to just being like match words on a piece of paper. So there is no gut instinct for the AI. But I do think for sure that we overhype the gut instinct versus for example, in medicine, 95% of the time, if you hear hooves, what is that saying? If you hear hooves, think
horses, not zebras.
Exactly. And that's how it is most of the time, right? And you need Dr. House to figure out when it's a zebra. But most of the time, the AI will be like horse, and they're right. So let's focus on the complicated things with the Have people focus on the complicated things. And I mean, it all remains to be seen. It's so early on. All right, so let's get to the part of the episode I extracted my daughter from the room for, which is someone comes in with this, what would you call, what's the technical term?
The medical term is priapism.
Priapism, yes.
Yes. So essentially, he uses injectable medications for ED, erectile dysfunction, and he has a complication where he's had a problem now for 8 hours. And if you don't take care of it, then you can potentially lose blood flow to that part of your body, if you know what I'm saying.
Well, the funniest thing about it is I mentioned this to you before you saw the episode. I'm like, well, there's this scene you got to check out. And where that poor, nurse, the shadowing student nurse has to stand there while they put syringes full of blood in there. And there's so much blood. I'm like, wow. The part of this was thinking, is like, oh my God, so much blood goes in there to sustain an erection. I'm like, bodies are so weird when you think about it. But you actually had this during your medical training, right?
I did. It's one of my most vivid memories of being a PA student in the ER at University Hospital in Newark. I had the noon to midnight shift, and one of the first patients I saw came in with that exact same problem for that exact same reason. He injected extra medication, and I saw him before the attending did, and I was like, oh God, this seems to need treatment. But thankfully, we did not provide the aspiration treatment. We had the urologist come in and do it. So thank God I didn't have to do that.
Oh, I thought you had actually had to do that.
No, I was traumatized enough just looking at
it. Just looking at it.
And they do have some close-up shots on this episode. So thank you for taking Charlotte to go brush her teeth so we could get through that scene without traumatizing our 10-year-old.
She would have a lot of questions. Yeah, and as you mentioned at the very end, we see this new, one of the mini, I guess the cliffhanger for this particular episode. There's always these little mini cliffhangers just to, I assume if you were binging this, if you could binge it, this would be the thing that would get you to push play on the next episode. So again, they're very much thinking about this as they design this show. We have someone come in to completely irrational. You know, something terrible is going to happen with this guy and understanding what his underlying case is. And as a matter of fact, if you see the trailer has a lot of his footage in there. So they think that something's going to happen with this particular patient. So of course we have that as a little hook for the next episode. But remaining mysteries here, a lot of them very underdeveloped in this particular episode, but I assume we're going to continue to linger over the course of the season. But of course, what's up with the baby? We don't really know yet. And who left the baby there? We did not see the deaf woman here in this episode at all. So still wonder if that's I believe that is the case, that she is the mother. Oh, and of course, what is up with this guy with the CT scan, McKay's patient, who seems okay now all of a sudden, joking about liking donuts and things, but seemed so disoriented last week. Do you still have any feel for that at all?
I still think he has a brain tumor. But I have no data to support that as of yet because he is still in the CAT scan.
Yeah, he's in the CT scan. And of course, the girl with the bruising, they're still trying to get her father to come in. Santos is very skeptical that the dad's going to show up.
She's convinced this is a case of abuse. And when they go to draw her blood, she doesn't flinch in the least. So they're like, oh, she's used to pain. Something's not right here. But we have yet to flesh that one out.
If it turns out that she just has a a high tolerance for pain, is there a diagnosis for that? Because maybe she is just smashing her legs into things and doesn't know, because she...
I don't know. We are the parents of a 10-year-old girl, and she's semi-hysterical when it comes to injuring herself, but she's inherited that from me. I just assume most young girls are a little hypersensitive. So I'm not convinced that it's just a high pain tolerance.
I mean, it could be a medical condition though. Is that a thing?
I mean, not that I know of. I would suspect she may have some sort of bleeding disorder more than a high pain tolerance diagnosis.
She's not a leper or anything?
I don't think so. That poor kid.
Okay, could be leprosy. I'm just saying, just putting it out there.
You keep bringing up leprosy. You think the baby has leprosy?
Oh, no, yeah.
The plague.
The plague. That was the plague.
The baby does not have the plague.
We'll see about that.
So we actually don't know yet. All we know is the baby had a fever.
Yeah, and overall, I like this episode. Of course, it's moving along. I don't with these type of shows, I don't expect to see a lot of development earlier on. Although I'm pretty certain that some of the characters here, and we don't even know yet because there's so many fake outs on these shows. Some patients will just get better halfway through and be like, "Thanks, doc," and disappear, and some will come back at the very end, and something catastrophic has happened. They've missed something important. So I'm sure that all remains to be seen. And that's why we watch these shows. This kind of, you pick your favorite patients as well and kind of bet on their outcomes. And it's developing exactly like you would expect from this type of show. And I mean, I think this is probably not as compelling an episode as episode one, because of course it's like us coming back to this world and everybody arriving and like, oh, I missed that person. But, it's just more of the same at this point. But we'll see. And I'm sure, we've seen in the trailer something, of course, catastrophic happens on this day. And I'm pretty sure it's fireworks related. That's my guess. Again, if I have to make a guess as to what's happening, why would they put this on the 4th of July?
That is a good guess, Victor. And I agree. This episode wasn't super exciting, but I like the storylines, I like the characters, and I will continue to watch with you.
You better. So, yeah, and on the show, podcast, I should say, of course, we will continue to discuss industry, which we just had the first episode with Darren last week. Darren and I will be talking about some movies we've been watching recently as well, possibly the 28 Years Later movie, which apparently is a total flop. So maybe no one watches it. We may not discuss it here on the show or just do a very short review of it. And beyond that, of course, Kim and I will be discussing Drops of God. If you do have Apple TV, do check out that season 1. I think you'll be hooked immediately. It's a really beautiful show, and we'll be covering it here. And I think I'm going to drag Darren kicking and screaming into talking about the new comic book, another comic book adaptation, which is also playing on Wednesday, by the way, on FX, this new Ryan Murphy show, The Beauty, which is kind of like The Substance, which was very popular last year. Apparently, that's the description of it. But most importantly, I was kind of on the fence. Maybe I'll dip in. Maybe I'll wait till the middle of the season, see what the reviews say. But then we heard this week that 190 million people watched the trailer for that series in the first week. So I'm like, Darren, I think we have to talk about this show because apparently lots of people are interested to watch it. So at least we'll be in there at the beginning and then we'll see how long we can tolerate it because we have, as Darren has said, Ryan Murphy has the highest percentage of pilots he's watched that he has never finished. And I'm like, I think I'm right there with him. I think about American Horror Story, where I think I've watched the first 1 or 2 episodes of every single season of that show, but never finished. maybe the first 2 seasons I finished, and then I'll watch 1 or 2 episodes and be like, nope, not for me. So we will see if this is a nope or a yep.
Thanks for having me, Victor. I will see you next week. Or in 30 seconds.
Unfortunately, both. No, just kidding.
Unfortunately.
Do you have any interest in seeing The Beauty, by the way?
I don't know anything about The Beauty, even though you just described it.
You liked The Substance.
I did like The Substance, except for the ending, which was horrendous.
Darren loved the ending. I agree. I was like, the ending is where the movie went off the rails for me.
Completely fell apart at the end. So if The Beauty does that, I'm not watching it.
So maybe watch Beauty for the first half, and maybe although it's much longer, a whole season.
I already have 2 assignments, which is The Pitt and Drops of God. I don't know how many assignments you think I can accomplish.
This is a good point. You can barely watch an hour of TV a week, so that is already a tolerant for you. So I mean that's already beyond your tolerance. So yeah, we'll see how much. But Darren and I will at least sample that show, So yet another thing we'll be talking about here on the podcast. All right, everybody. Thank you. And thank you, Kim, for the conversation.
You're welcome. Goodbye.
Bye.